Okay, everybody. This is Tim Alexander. He's gonna talk about pros and cons of being in a trust and how it works for municipalities.
How's your morning been? Right, we'll talk about insurance for a little while. It's a lot of fun, especially for the insurance people. And so I did ask Braden to join with me today. Braden actually works with a lot of our trust groups as well. And it actually touches all of our trust groups from an account management standpoint. And tell you a little bit about Cottingham, Butler, and about myself. And we'll talk a little bit about the trust and see what kind of questions you come up with, since it's the time of year that you're probably going to get insurance renewal. If you're on a 1-1, it's probably going to go up. And we have found a solution to maybe not keep your costs from going up over time, but hopefully keep them going up more slowly, maybe a little bit less painful for you. Any of you familiar with Cottingham and Butler? All right, a little bit. So we're one of the best kept secrets in Iowa. We're actually the largest brokerage in the state of Iowa. We do business all across the United States. We're actually based out of Dubuque. The company was founded in 1887. This is my 18th year at Cottingham and Butler, so work with a really great group of people. My previous record of working someplace was 7 years before that, so it's a really good place to work. A lot of great people doing a lot of great things for our clients. Wellmark had approached us a number of years ago and asked us to partner with them on this trust, and so Wellmark is the insurer that's behind it. And we'll just kind of go through these things and let me know if you have any questions. And so it's an exclusive program designed by us. It is for cities and municipalities. And so we do have waterworks in here. There's a utility company that's in here. There's a housing authority that's in the group as well. But most of the rest of the groups after that are cities and counties, right? The program is compliant with all 28E agreement rules. So we do also meet all the open meeting requirements during the course of the year. It's a fully insured health plan. We you do have the ability to do some what we would call partial self-funding or split funding, and we'll talk a little bit about what that looks like if you're not familiar with that. And then just like any traditional brokerage consulting firm, we do work with all of your other employee benefits as well. So dental, vision, life, disability, voluntary programs. And so this is the structure. So you as the city, county, municipality sit at the top, the trust sits underneath that. And then there's really three pieces that fit underneath that. Wellmark as the insurer on the back end. We own a company called Cisco, the Self-Insured Services Company. It is a medical TPA. They process self-funded claims. They actually do the partial self-funding, the buy down, if you will. And then Cottingham and Butler is actually the trust administrator. We have 18 groups in the trust currently, about 2,500 members, 950 employees. We talked a little bit about the miscellaneous, and so the waterworks is in there, outgoing municipal utilities, the Cottingham Housing Authority. We have a few counties, Dubuque County being the largest, and then a number of different cities across the state of Iowa. If you know these people, one of them's here today for sure. You can also check in too. And then I do believe that Marla's going to email this to you as well, so you're going to get a copy of this. Long-term rate stability is what we're after here. There also is an ability for you to save money on the front end, unless either of you know differently. Of the groups, the 18 groups that have joined the trust, I have never not seen a group that did not have rates lower than being with Wellmark Direct. Just want to repeat that one more time. The trust rates, as of today, as of the 18 groups that we've had, they've always been less than what you have today. How many groups are in here that are less than 50 employees? Okay, you're really going to benefit from the trust the most because there's different underwriting structures that Wellmark has you in. If you're below 50, you're in what we call state filed rates. And so Wellmark sets those rates at the beginning of the year for their different health plans. They file it with the state of Iowa. There is no fluctuation. The only change would be like your demographics, how many male, female, single family enrollments you have. Those rates are filed. So if you're a good running group, you have great experience over the course of time, you get the same rates. If you're a group that has a lot of healthcare issues, you run really bad, you get the same rates. Once you get above 50, that allows them to do some individual underwriting based on your group's demographics and how your group runs. And so now your group rates might be less, they might be more, bad experience leads to higher rates, good experience leads to lower rates. And so when you join the trust, you actually become part of a large group pool. And so you become part of a large group underwriting pool. And so all the small group rules would go away for you people that are below 50. And generally, those are the groups that save the most amount of money. And Beth could probably talk to that a little bit themselves. You can use that money to build up your healthcare account for renewals going forward. We've had groups that have improved their benefits, improved their health plans for their employees. There's a number of different ways that we can structure that to help you out. How am I doing? Any questions so far? Saving money is great. All right. So self-insured services from Cisco, they do the administration of the partially self-funded program. And so Wellmark allows us to feed those claims automatically. How many of you are today partially self-funded? I should ask that. Okay, we have a couple. So a couple know what I'm talking about. So envision it this way, if you will. We typically buy a 5,000 or a 6,000 deductible plan from Wellmark. And then we buy that down to whatever the deductible or out of pocket is that you want. So let's just say, and I'm a really simple math guy, so work with me. Let's just say we have a $1,000 deductible plan. Okay, so we're going to buy a $5,000 deductible from Wellmark. The employee is going to pay that first $1,000 of claims deductibles and out of pockets like they always would. And then you as the entity would fund the claims between the $1,000 deductible and the $5,000 deductible. What happens is because you buy less insurance at $5,000 than $1,000, we're going to take that money and put it into a budget for you to pay claims out of. And at the end of the year, what you haven't exhausted is yours to keep and roll over. Okay? You can put Beth on the spot and talk to her about her healthcare claim account because she's had a healthcare claims account that I think we've helped grow. And so the goal is really for you to budget based maybe on what you had, see how the claims run through the course of the year, and then just readjust your spend the next year. And so I have entities that have changed their tax structures based on how the trust is run. I've had entities that have improved their employee benefits based on how the trust is run. I have entities that sit on a healthcare account and then they just pay their increases out of the healthcare account instead of charging the employees for more the next year. So there's some really cool things that can come out of it. And so from a user standpoint, what does that mean to your employees, right? So I go to the doctor's office with my Wellmark card. We do get a little bit of confusion depending on where you are. And so this isn't something that just happens for cities and counties. I should actually clarify that. We have lots of private companies that actually, and non-for-profit companies that do buy downs all the time. And so it's something that happens in our industry all the time. And so I go to the doctor's office, I use that Wellmark card. They're going to process that claim to Wellmark. Let's just say it's in that window of that $1,000 to $5,000, so the city's going to fund it, right? And so that claim is going to automatically go from Wellmark to Cisco. And then Cisco is going to charge you, the city, and you're going to fund that claim for that next portion. And it's going to generate 2 EOBs, explanation of benefits, one from Wellmark, one from Cisco. And then the only education we need to do for your employees is that they always have to pay off the second EOB. So it actually works pretty slick and it's pretty hands-off as you as an administrator. The one thing that would be different than what you do today is that you pay your premium once a month with Wellmark and then you kind of put it away. You would get a request for funding on a weekly basis based on any drug or medical claims that are going through the plan that you have to fund. And then you would just release those funds on a weekly basis. So you still pay your fixed costs once a month, but then you're just releasing funds. If you don't owe anything, nothing gets released. If you have some claims that go through, you have to get those released. Any questions about that, the structure? Clear as mud, or we're doing great? If you have questions, just ask. So there is no dumb questions. I do it on a daily basis, so I think it's easy, you know, and I've done it for 18 years. It is actually really, really easy. And then you do get monthly reports, weekly reports on what you're funding. You'll have access to those claims. You'll be able to understand what that cash flow looks like. We'll budget for you so you know what you're protecting yourself with on a monthly basis. There's also a claims lag. And so if you think about how claims are paid and processed, you'll have an opportunity to have some money in that account before you actually start paying claims. And so hypothetically, if you join the trust on 1/1/24, you're probably not gonna see any claims start to come through till the end of February, beginning of March. And so you will have already budgeted 1 or 2 months of dollars into that account to start paying claims out of. This is it's a little bit difficult slide, but it's a really cool slide. So we're talking about long-term stability and what the 6-year rate history has been of the trust. The trust is actually pretty young from an insurance standpoint, when we started it, but what the little boxes represent is the, annual increase that we ended up with. This year it was 6.5?
Yeah.
It was 6.5%. We need to add the 23 renewal on there. But this is the loss ratio year over year. And so the preferred loss ratio for insurance carriers is anywhere from 75 to 85%. We've been running pretty well at that 80 to 90% ratio. We had a bad year in 2020. The trust this year is running at about 90%. So about half the groups are running well below that 75 to 85% loss ratio. We have some groups that are running a little bit hot, a little bit over. As we look at the average, it's running about at 90%. And so that leads to some rate stability. I think our renewal this year will be similar. But when you get your renewal increase, it's off the premium piece, and we're buying less premium than you are if you're fully insured today with Wellmark, because you're not paying any increases on your claims piece of it. Any questions about that? Okay. We look at annualized cost per employee. Municipalities are interesting because most of your employees work for you forever. So you have them from marriage to death. And as we get older, we get more expensive. And so your cost per employee is generally more or higher than if I was a manufacturing company in your town. You generally, as a company, run probably $3,000 to $5,000 higher per employee than if I was an individual employer. And a couple things come out of that, right? You had bargain labor for a number of years. Most of you, when Branstad left for China, didn't change, how you do your employee benefits for your employees. And so your benefits you're generally very generous. The other piece of that is you usually don't turn over very much help, right? So you don't have necessarily a big flux of young people coming in. So the combination of rich benefits and being older than average leads to a little bit higher cost than we would see in a general private employer setting. But the good news is that if we look at trend over the last 6 years, so we talk about medical and RX trend, it's been about 8%. And so if you look at the trend line of the actual trust groups, they've been well below 8% over the last 6 years. And so that's the big takeaway, is that we're buying less insurance, generally it costs less. We can outperform the markets by doing some partial self-funding. And hopefully you can keep your benefits in place without charging more for them or making dramatic changes to them over time. We prepare all the trust agreements and all the addendums. We execute the annual meeting each and every year. Join the trust. You can see me speak again, apparently. I found that out yesterday. We negotiate the annual renewal with Wellmark. The trust is set up to be a little bit differently than maybe what you do today as well. It's all tied to the annual fiscal years for most cities and counties, which is on 7/1. So the trust actually renews on 7/1. We generally have the renewal by the end of January. First week of February is the latest, but our goal is generally to have it to you by the end of January. So it's right in line with when you're doing your budgets. And so you can do your budgeting for your healthcare. The rates go into effect on 7/1. All the deductibles and out-of-pockets always run on January 1st. And so there probably isn't a change there. You can join the trust at any time during the course of the year, especially if you're a Wellmark. Is there anybody here that's not with Wellmark? Okay, so it's really easy to flip you over if you want to join the trust. And so you can join the trust at any point during the year, but your renewal date will move from wherever it is today to 7/1.
Do you have to have a minimum number of employees?
Not if you're with Wellmark, probably. It used to be that we did. But if you're with the problem is when you're not with Wellmark, they don't know what they don't know. So like if you're with United Healthcare and you have 10 or less employees, you know, what does that risk look like? And generally we stay away from that, but if you're with Wellmark, we generally will take you. So. I think that, what is the smallest group that we have? City of Garner?
City of Mitchell, City of Garner.
Oh, yeah, the city of Mitchell was really tiny. How many did?
12 or 14.
Okay. Any smaller than that?
Yeah. Yeah, so when you say probably, I mean, you said you probably would do less than.
Well, if you have a health plan, there's two things that are different. Sometimes people talk to us, they don't have a health plan, and that's totally different than you have a health plan. So we could sell you a Wellmark health plan in the trust.
With minimum of even 1, 2, 3 employees.
If you have a group health plan, we could sell you a health plan in the trust. Yeah. I had a gal call me the other day, they don't even have a health plan, they have 6 employees or something like that. So. Yeah, we can get
don't
you.
have a group health plan.
What's that?
What if there's no group health plan?
That's a different underwriting process. You'd have to fill out apps, and you'd have to start a group health plan, that sort of thing. But you could sure do it, and we could sure help you with that.
If you have a group health plan, and only one of the employees out of 3 takes it, and the others are allowed to do something else. Is that still considered a group health plan?
Probably not. Are you buying it from Wellmark? Are they billing it that way? Yeah, probably. And so, so generally, insurance rules are generally you need 2 people to make a group. So I'm not sure how you're getting away with just having 1 person.
Creative.
Yeah, but if you're already with Wellmark, Wellmark will take you. So. Traditionally, you have to have 2 people in insurance.
Are you able, like, if we told you what our plan was, you're able to say like, okay, if that's a group plan, or. Like if we say, this is what our plan looks like now.
Yeah. We sure could. And you also don't have to do self-funding either.
Yeah.
And so if you're a small group, you could buy one of our off-the-rack plans. And so we have other plans. We would
Sure.
try and match your plan the best we can. Because you may not, with like 4 people, want to do a partial self-funded plan and open yourself up to exposure. And so we could sell you a plan that is similar to what you have. And then you could just buy that off the rack. And your rates would probably, I mean, they wouldn't be about the same. They'd be less than what you pay. Because you're small group.
So and there's, so it's like they're going into the pool, even in a small group of, let's say, 1 to 5. They would see the benefits of being part of the trust pool.
Yeah.
And get the benefit of having the 15 over rate.
Correct.
Would you come and talk to our council or?
Yeah, sure. Are they gonna be nice to us?
Are they nice to
Depends.
everyone?
If you say the money, they might be.
Yeah. So we have a lot of small, maybe not as small as you, but there are a lot of small communities in there. I mean, the city of Garner is small, city of Mitchellville is small. They have 12 employees, 12 employees on the plan, right? I think that's correct. Yeah,
They're less than 1,000 people.
yeah.
They might have 9 or 5.
So, you know, we want to grow the group, we want to have a bigger pool because then everybody benefits from the bigger pool. So if we can help you and get you in a group, we will sure do that. You get a dedicated service team. We have a lot of people on here that are on the backside, but mostly the people you'd be communicating with would be myself, Braden, and Ashley. We are the people that hold people's hands. And so if you think about if you have employees that have questions about claims, they have an ongoing claim issue they don't have straightened out. Ashley and I had a nightmare scenario a couple of years ago where a guy worked at the city of Forest City for 3 years. He had Wellmark insurance before that as a prior employer. I'm not sure what happened between the prior employer and Wellmark, but they shut off his insurance coverage one day. Because he was listed on both plans, and that's how he found out. And it took her about a year to straighten out his claims. And so I don't know what somebody was doing paying insurance premium for somebody that wasn't on their plan for 3 years and why, what happened. There was an audit that took place, but we're here to be You know, the first goal is always, the first line of defense is you, and then it's the 1-800 number, and then if they don't get resolution from there, it's for us to help. So. We are long time, well-marked, in deep with them, so, we can certainly help you. We have our own claim people to help you. And so if your employee or yourself happens to be in 1-800 help, we can help you get out of there. Right? So what other questions might you have about health insurance? We have how many plans available for them to choose from? 20 different plans for you to choose from. I'm sure they would be probably similar in plan design to what you're buying today. Because as you've been in that small group market, your choices, I don't know how long you've worked there. Yeah, your choices have gotten smaller and smaller and smaller and continue to be. And so we do have 20 plans for you to choose from. And then once you're in the trust too, the other thing would be, you know, how Wellmark likes to toy with your deductibles and your out of pockets each year. That wouldn't happen anymore either. Your plan would be what it would be going forward. So maybe you could add somebody.
Maybe just to add a little bit of information, I would just, you know, the city of Asbury went into the trust. We've been in a couple of years now, and prior to being in the trust, we were with Medical Associates, and when we first entered in with Medical Associates, you know, they gave us an open provider pool, and as, you know, you go from renewal to renewal, you know, things get smushed down inside, you know, and tighter, and so on the one renewal, we're trying to also, you know, save money. So we used to be Medical Associates, an open provider pool. Then it's like, okay, the next renewal came, and if you want the open provider pool, it's a 10% increase. And if you want just their HMO with their doctors only, then it's, you know, a 7% increase. So then it's like, well, okay, we will do that, and we'll keep everything, you know, everything else in the plan the same. And so then when, you know, we started talking with ICT, Medical Associates was taking our current plan and doing a renewal, and they're saying, okay, we'll give you a 5% increase, but what happened then was office co-pays were going up, deductibles were going up, and we ended up with ICT and doing some self-funding on our own, and the employees' deductibles and out-of-pockets were decreased. The co-pays stayed the same, and we only had like a 2% increase in our health insurance for that year. And then we also offer 2 plans to our employees. We offer a fully funded plan. We also offer an HSA to our employees. Since we went into I call it the pool, when the year they had the, big increases, it was an 8% increase to our plan. And then last year's renewal was a 5% increase to our plan. I can say the service has been good, although I think I had a call from you about it, or Elkader. Somebody from Elkader called me, and then if you are with Wellmark, they will call you and ask you to make him your agent of record.
Oh, yeah, we should probably talk about what the process looks like.
So, just be aware that question, but overall, for what we've seen for renewals, I think the benefit is that those small group, you're in those ACA plans and you're age rated, and there isn't much, movement to that. So being in with a larger group gets you more benefit of having more bodies, and you're gonna get increases, but you can probably manage with a few less, at least, is what we found.
Can I ask what your cash accrual was in your claim funding account?
30,000, right?
What did it start with? Was it 30,000 still?
You mean as far as when we started these?
Yeah.
No, we started at 0, but no, if I put 7,500 in
Okay.
the fund claims, yeah,
Okay.
to be sure.
So,
But I don't think we ever, I'd have to look, I don't think we ever went, below that 7,500.
okay. I was just curious.
Because and I think a lot of that had to do because there's the lag, so you do have a couple of months Well, we have 20 people too, so you have a couple of months to put in claim money
Right.
before the claims come in.
And so what she was referring to is I can't get you trust rates when you're with Wellmark unless you're a client. And so you do have to take a leap of faith. And I know sometimes that's hard because sometimes it might be the mayor's friends, or it might be the local insurance person that has your group health plan. And so you would have to take a leap of faith. You appoint us as your agent, and then we release your rates and we compare that to what your current rates are, what your renewal rates are.
And I should probably say we are partially self-funded, so we
Yeah.
buy that higher deductible plan. And so, it becomes like, we get the bill from Wellmark. And we pay that like, you do it, the bill, we see the bill from Wellmark. And then what we do with the part that we self-fund, include that as part of a premium, as part of the overall health insurance cost. And I move that into an internal service fund to pay the claims from, with a separate bank account.
We will calculate for you, for your budget. And so, you have to account, not everybody does. So I have to be careful what I say. In my view, you need to account for claims. And so we do have a couple clients that, the city is just funding the claims and they don't necessarily, they account for the money. But in our view, you should account for it in like what your COBRA rates would be, right? Because you're gonna get your premium from Wellmark, and that's not really what the exposure is from the city. The exposure to the city is the premium plus the fixed cost for having the third-party administrator, plus what your claims estimate is on a per employee per month basis. And so we come up with what we would call COBRA equivalents, which would be appropriate for your budgeting, what Beth is talking about. And then also, what you would charge somebody if they left your employee as a COBRA participant as well, so. What other questions might you have?
Okay, I might just be hung up on this getting started. Because I know you said something about like having to take a leap of faith. And so, but can I give you, I could say, okay, this is the plan we're on. Do you have something comparable? And kind of an estimate?
Yeah.
Without just saying we're going with you and then,
Yeah,
oh crap.
yep,
Okay.
yeah, there's never been a no crap moment. I've done this for a really long time and I've never lost a trust account. I've never seen rates not be less than the trust than they are from the standard market, and so that's why it takes a little bit of a leap of faith for you to convince your counselor or whoever it is you need to convince that this is the right thing to do. But once we do that and you get there, it's pretty easy. So we just did West Union not too long ago. I don't know what her savings were, either of you. Not to
Well,
put you on
I
the
guess
spot.
to that point, before we took that leap of faith, we had our medical associates quote. I had my quote.
Well, and that's, I totally should be able to get a quote before we just said,
Yeah,
okay.
yeah, and I had my quote.
So you can't actually get a quote.
Well,
We
and
can
then
give
the
you an
quote was
estimate.
estimate.
That's the plan
Yeah.
design and stuff.
Yeah.
Yeah. Especially when you're a small group, you're going to be, you're going to be less, so.
You could do, we have both. Yeah. Now we can. Now it's the other thing for us.
But we can show you what the plan, if you let us know, what it is you buy today,
Oh,
we'll
yeah.
show you what that
I'll show
looks
you,
like.
I'll give you a copy of our plan, I don't.
Yeah, and we'll show you what that looks
Okay.
like, and then we can do some, estimating for you, guesstimating. But that's a Wellmark rule, it's not like the Cottingham and Butler, rule, so. It is what we call the leap of faith. You bet. Any just like general insurance questions before I let you go today? Anything you need help with, you don't understand, you wanna know what's gonna happen in the world?
You think it's gonna go up?
It's going to go up.
10%, it always goes up.
I want 5. I just
5%.
Yeah, just to kind of give you some headway into some, make you look smart with your city council and stuff. The biggest problem we have right now is drugs. And so if you've been paying attention, the government is funding drug prices as well, right? had a lot of talk before Trump got out of office. He was beating on the drug companies and the PBMs fought back against that. And then the pharmaceutical companies fight against that. I have a subscription to the Wall Street Journal. And many times when I open it, it says that your PBMs don't deserve to get the money that you are getting paid. The pharmacy benefit managers, people that process your drug claims, is paid for by the pharmaceutical companies. And so, if you read the little fine ad on there, and I used to work for a pharmaceutical company a long time ago, full disclosure. And so, like the top 10 Medicare drugs that are prescribed and bought today have gone up 700% in price in the last 10 years. It is ridiculous. So the good news is that we're coming up with drugs that save people, right? Or make symptoms go away or do other things. The bad news is what they're being charged for. And then there's some things on the horizon called gene therapy, which are really, really scary. Because if you get one of these people, it's like winning a lottery ticket. So it used to be like a hemophilia act might be one, but there's a bunch of other disease states that they can attack with gene therapy. And these drugs run $3 to $6 million a year, sometimes $10 million. So heaven forbid if you get one of those on your plan, that can be out there. But even like common things, you know, I remember a few years ago when Humira came out, it wasn't a few years ago, it was like, I guess 15 years ago. And the drug was like $1,000 a month. And we're like, oh my God, that is nuts, right? And now it's like $5,000 a month. And so, and then they get other indications, right? And so that's an anti-inflammatory. It was first used for osteoarthritis. But then what we found through injecting people is it will take away inflammation from everything. So then it does Crohn's disease, then it does eczema, and then it does all these different things, right, in a body. And so they get all these other indications, which pushes generics out further and further and further. Medical trend is probably about 5% right now, just on medical itself. The other thing you might be seeing some complaints from your employees from is what's happening with dental. And so since COVID, dental costs have gone up and up and up. So I don't know if you've had dental work done in the last couple of years. You'll find that $1,500 or whatever your plan benefit max is doesn't go as far as it used to. So I just, myself, I split it over the plan year. I tried to be a good, smart insurance person. I just got burned recently on my second teeth cleaning this year. I got an implant last year. I got the tooth pull on this year. I spent my $1,500 annual max. Went to the dentist office, got my teeth cleaned, minded my own business. They're like, hey, you're due for bite wings. Like, that's paid for by the plan, not a problem. Well, I'd already hit my max, so I ended up paying $240. And so your $1,500 max doesn't go as far as it used to anymore. Dental costs have really gone up, and we don't hear much about that. But we'll see what happens with the pharmaceuticals. There's some stuff going on. We're actually seeing some legislative movement where some Republicans and Democrats can finally agree to some things to get some stuff done as they beat up on some of the stuff that's going on with the pharmacy benefit managers and then some of the stuff that goes on with the drug companies and the pricing. So we'll see. There's a bunch of drugs that are coming off patent. So Humira is coming off patent. It's the #1 drug in the world right now. So there'll be some relief there, or actually it is off patent. So those are kind of the things that we're faced with on a daily basis. You know, if you're a fully insured group and you get a renewal, sadly enough, that's below 10% right now, that's actually super. We're seeing fully insured renewals. I don't know what the highest is that you've seen. My highest was 17%, and I feel pretty lucky. I've heard of some 40 and 50% ones. There's just some bad stuff that goes on out there when people get sick, and it doesn't take long to spend a lot of dollars when you're in a hospital. So be wary. Costs are not going down. You've been dying to ask me a question.
No, you've been looking at me like, oh, she's gonna open her mouth. We are currently with Walmart on a grandmother plan.
Yep.
And you've given us pros for the trust. What are the cons?
So you're like a dinosaur currently,
Yeah.
because not many of them exist anymore.
And our renewal is January 1.
Yeah.
It's 11.82%.
So the one thing that, well, let me flip it around for you the other side. And so when we did grandmother and grandfather plans, that was to protect ourselves from the Affordable Care Act.
Yeah.
Right? Because we didn't want to do all the things that the Affordable Care Act wanted to put in. All that stuff has been stripped away from you over the last 10 years. And so the vast majority of the stuff that you hid from has been taken away from you. And so I would say that the alternative is a benefit to your employees. Is that if you go into, and so everything we sell is Affordable Care Act, they're all ACA compliant plans. And so you will get your preventative covered at 100%, which is a positive for your employees. Everything that you spend out of your deductibles and out of pocket, or deductibles, co-pays, will all track towards your out-of-pocket max, which they don't today. So that's a benefit for your employees when they're really, really sick. And so I would say there's really not a benefit for you in keeping your grandmother plan, except for that rate holds maybe less than somebody else because you cover less. But we have moved some plans that were grandfathered and grandmothered into the trust, and their employees have benefited from it. And from a cost structure, it wasn't wildly different. And so it was pretty easy for them to make a move. That was a really great question. I'm glad that you held on to it.
Well, we do partial self-fund and not this year. Last year, we had claims of 1.4 million. So obviously, we're starting ground zero. If we would, go into a trust. Last year, we only had 130,000 with the claim.
Yeah, but you mean Wellmark paid, not you
Right,
paid.
right.
Yeah, so hang on there. I heard some people suck in some air. She didn't spend 1.4 million.
It depleted our partial self-funding and,
Yeah, I work with a city that beat the snot out of theirs every year, for, I don't know. And people just started retiring and it turned around, so, they're actually, a couple of their large claimants have retired. That's helped them out a lot. This year, their loss ratio is running like at 50%. And so for like the first time in like 4 years, they have money in their partially self-funded account. Yeah.
are there fees that if you see Walmart plan that we have, they incorporate all their fees and everything into our premium?
Yep.
As well.
We will too.
And what if somehow you end up having to pay those back? I was, told that there are times that if you don't do, I don't know exactly how she explained it, but there's a potential if you don't meet certain, if you go above or whatever, you may have to pay some fees back if you don't have that. If you don't.
I have no idea.
Yeah, I was told it, but I didn't understand it either, so,
We're pretty locked and loaded in what we do.
yeah.
We'll never come back to you and ask you for more money.
I wonder, would that be a thing if you depleted your self-insurance fund that you would be, have to pay those additional claims possibly? If
Those
you
wouldn't
have
be
enough-
fees though, that would be, so hypothetically, and so let's talk about that. And so the reason you win in doing this is the law of large numbers, right?
Mhm.
And in her case, or like this other city I'm speaking about, you had a number of belly buttons. And so it's not just your employees, it's the people that you cover, right? It's spouses and kids. And so all those people can run towards your deductible and out of pocket. And it's your money until they hit their deductible and out of pocket. And so if you had multiple people across your population hit their deductible, hit their out of pocket, they are gonna deplete that claims fund. But once you've paid on everybody, there should be nothing else to pay
For that year.
for that year, yeah.
What, like taking last year, for example, I mean, that would have. I guess,
Well, so when there's a large claimant though, once you've paid your $5,000, it's all on Wellmark. So let's talk about that. So if you have a $2 million claim, that's all on Wellmark, and that's the same the way it is today too. And you're never even, so in the small group market, you're locked in those small group rates and their filed rates. And so Wellmark is spreading that risk across everybody. And so we're just creating a different risk pool, which is priced differently than Wellmark's regular piece of business, that we're spreading that risk across. And so it just so happens that our pricing is less than what the standard markets are. Our trust has really performed really well too, compared to the other trusts that they run. So,
thank you.
yeah, those are great questions. Good job. Way to hang on to that. Anybody else, grandmother, grandfather plan?
Teresa.
You have one?
We are.
Yeah, it's pretty rare anymore. I don't have any private insured plans anymore that I have done that, so Because most of the benefit got stripped away from you over time. And then most times, when you think about hiring employees, you hire somebody to come to work in your streets department or someplace, they came from a private industry, and all of a sudden they go home and tell their spouse that all their preventative care is not covered at 100% anymore. We have to pay co-pays, deductibles out of pockets. You think about mammograms, and you think about annual physicals, colonoscopies, over 55, all this stuff, and all of a sudden they're like, well, wait a second. You may be making $2 more an hour, but we're paying a heck of a lot more when we go to the doctor's office. And so there is a benefit from you moving to that other side as far as you think about competing and retaining talent. It can become a really big deal for you. Last thing for you, I'll let you go, or how are we doing on time?
Great.
Doing great on time?
Yeah.
I am fast.
2 minutes, don't get carried away.
So we do have some tools for you, that we make available to you. So if you think about, if you have people that are turning 65 and they're looking at retirement options, we do have a firm that we partner with that work with you for free,
Good to know.
called Next Level Planning. You're not-
Are you announcing this?
Yeah.
I will be turning 65.
And so they will advise your 65-year-olds and above when they get to a point where they start thinking about retiring, on their health plan choices, help them understand Medicare, help them understand supplements, that kind of thing. That's provided free for you. We partner with another company called Mineral that really becomes a backup HR team for you. You can ask them HR questions and they'll send those answers back to you. And they'll cite what employment law they're taking those answers from. There's also a different number of different training videos and such out there. So if you want to do some training on sexual harassment, for instance, you could bring all your people into the office, make them watch the video, make them sign a form that they attended. You have people that answer the phone, you want to do customer service training. There's slip and fall training, and there's hazardous waste handlers training. There's 300 different training videos that you can use for free, and that's provided to you for free as a client of Cottingham and Butler. We have another site called MyWave. It's more of a data housing site. Like if somebody came in and asked you about flexible spending and you're not a flexible spending expert, you can go out on your computer, look up flexible spending, and it'll give you the sheet. It's all copyrighted and paid for. You can put your city logo on it if you want, and hand it out to them and say, here, this is what you can do with a flexible spending account, HSA account, that kind of thing. So that stuff is all out there as well. What else? That's kind of it. I think that's it, Marla.
Okay, great, thank you so much.
Yeah. If you find yourself having questions, or if you want to talk to other clients of ours, Marla's gonna email this to you, right?
Yep.
So you'll have a copy of the presentation. You can contact any of those entities. You can talk to Beth if you like. And then if you want to continue the conversation, get a hold of Brayden and I, and we'll come talk to you a little bit about it, more specifically.